we are doing is surveying and interviewing EMS agencies, usually fire departments and hospitals throughout Alabama, about their interest in community paramedicine and mobile integrated healthcare. Community paramedicine is when paramedics receive additional training to perform more medical services, such as monitoring diabetic patients at home or chronic heart failure patients at home in order to keep them out of the hospital. Mobile integrated healthcare is when EMS partners with other healthcare providers to provide additional services.
Everybody hears all the time now that emergency departments are overcrowded, and many times they're overcrowded with patients that really don't need to be in the emergency department. They're not, quote, emergencies, they're not serious. Many times it's a lack of access because patients just can't get in to see their primary care doctor if they have one, and sometimes they don't have a primary care doctor. So if we can treat those patients at home with community paramedics, it's just a win-win for the whole situation and the whole system, and that the emergency department's not overcrowded with non-emergent patients. Patients can be treated at home, and the third thing is it can save healthcare dollars.
So Action originally started out with having a nurse practitioner who would ride along with EMS responders, and this person would respond to low acuity medical calls where we thought the nurse practitioner could treat the patient on site at their home instead of transporting them to the ED. We also had mental health units where psychology graduate students would ride along and would do the similar thing for mental health calls.
The whole purpose of our mental health response team is to be able to provide the fire department with an alternative tool so that we can therefore provide the patient with a different option of treatment.
So the plan is to help answer some of the questions that they have for us, such as, we want to start this program, but we're unsure about what Alabama's rules and regulations are at the state level for paramedics to start these services, such as how do we license these professionals, how can we pay for them. So we hope to answer those questions for them, either for a training specifically that would happen for the fire departments around these programs, or possibly creating a learning network where agencies that are interested in these programs and maybe starting them can get together and share with each other how they're working out these challenges in their community.
This is a telecoaching project where we're able to provide support to professionals who work in early intervention, and these are professionals who work specifically with families of young children either with or at risk for autism spectrum disorder.
Early intervention for children with autism or at risk for autism is extremely important for a couple of reasons. Number one, the developing brain of children requires us to get in early while there is plasticity going on in the brain development, so that the social and communication skills that these children need are being developed right when the brain's developing those skills. So that has to do with the child. On the other hand, the second reason is because parenting of these young children or other caregiving of them, patterns of caregiving start early on in families, and so for us to provide the supports to those families early on is critical for helping them have the skills, knowledge, and confidence that they need as parents.
We use these telecoaching devices that we distribute to the professionals who participate, and they're able to use these devices in one of two ways. We have an in-the-moment condition where the professionals use the devices to receive coaching from me during their actual home visits with a family. The other group receives video review feedback. So instead of having that in-the-moment support, they video record their home visits with their family, and then I'm able to view that home visit, and we're able to talk about that video together.
We've been moving toward routine-based interventions and also routine-based home visiting, and we realized that we really need to do a better job of coaching families within their natural environments. And through this project, I think we're going to be able to learn what's the best way to do that.
These are professionals that we're working with, and they bring a lot to the table, and the caregivers bring a lot to the table as well. And so we view this as a very collaborative process, almost like a brainstorming process. Autism is a tricky disorder, and being able to have more brains working together and figuring out how to support these really young children with social communication delays or with an actual diagnosis of autism is really helpful in having everybody working together and trying to come up with what supports work best for that child and family in that moment.